Hello, everyone, and thank you for joining us today on World Mental Health Day, a day dedicated to raising awareness of mental health issues across the globe. Today, we want to focus on a topic that has increasingly been spoken about and has been felt affected in our country, which is work stress. Despite gaining public attention and sparking widespread concern in recent times, it is a topic that remains tightly under wraps. Contracts, workplace culture, and fear of job loss are among the many reasons why discussions around workplace are still shrouded in mystery and vagueness. However, let's not do that anymore. Today, we have a very esteemed guest, Dr. Adithya Sunka, who will be speaking to us about work stress. He will delve into all the questions that we've been having about work stress. And I'm very pleased to welcome you, Dr. Adithya, um, to the webinar.
Yeah, hi.
Hi, Dr.
Thank you, Vidya, for my introduction. So myself, Dr. Aditya, I'm a consultant psychiatrist. So earlier, I graduated from the Manipal College of Medical Sciences. Then I did my MD from the prestigious institute NIMHANS at Bangalore. Later on, I worked as a assistant professor in Kakatiya Medical College, Warangal. Okay. Later on, I started my own private practice, Ananda Mind Clinic, recently, which was started recently, and also I launched an app of Ananda Mind Clinic as well. So that's my introduction in brief. So thanks, Team Medicas, for inviting me and giving me this opportunity to talk on today's topic of managing the stress at the workplace. Thank you.
So, in this topic, I want to start with something that all of us, especially corporate employees, can relate to at a very personal level. So, there was a survey that was done by LinkedIn which found that 74% of respondents want more flexible work arrangement post pandemic. They've gotten used to either working from home or having, saving some time in traffic and, situations like that. So in such cases where people are transitioning, to from working from home to going back to office, what is your advice to them to not feel the stress of this transition?
Yes, definitely after after COVID-19, so we have seen a lot of rise of these mental health issues, and also there was a lockdown at the time. There was a breakdown in the corporate IT professionals as well, right? So then they started this work from home, because earlier maybe this might be there, but not so. It was not so into practice as such. But after COVID-19, then they have given the leverage of working from home, right? So usually, what happened during that transition is that individuals, they got adapted to that situation of having that flexibility of working at home, and having their own time, and they have that flexibility to relax as well. Okay, so that was going on, but eventually what happened, then lockdown got over. Then the corporate institutes or whatever, so they asked the employees to come over and work from the office. So it took a toll on the mental health of the individuals who were previously they had very good time at home, working at from the home, right, having that flexibility. But once this they started transition to the going to office, so it took a toll on their mental health, and they started panicky in most of the individuals, and who were not introduced even to the office environment in the
Yeah.
first place. Okay, who joined work from home only. They introduced to the job from work from home only. Who So they, once all of a sudden, once they asked these individuals to come to office, then there was a lot of panicky and anxiety was going on around these individuals.
Yeah.
So but definitely, what I would say is, there is pros and cons of both of it. Okay, working from home as well as working from office. So there should be this flexibility, work life balance should be there. Okay,
Yeah.
so I have seen individuals, I have seen the clients who come to me saying that being at home, it that is also too much stressful for them, right?
Yeah.
Because they are not going out of the home, they are not socially interacting with anyone, and there are I have seen the cases where there has been increase in the marital conflicts as well,
Hmm.
because they getting restricted to the home environment. Okay,
Yeah.
but at the
Yeah.
same time, working from office as well, that also has some of the cons, like they have to travel every day, they have to wait in the long traffic hours as well, right? So there are certain disadvantages of going to office as well. But what I advise or what I recommend is that definitely there should be a work flexibility. This if they wanted to work from home, then that leverage should be given by the corporate employers.
Yeah.
That should that will make them more resilient, and they will have that work life balance as well.
Yeah. So then what about people who don't have an option? Like what advice would you give to employees who are forced to go to work? Now they don't have an option, they have to go. So how do they, is there some, tricks that can convince them that okay, this is, I have to accept this and not let it stress me out?
Yes, yes. So there are certain institutions or offices where they don't have this option of working from home.
Yeah.
Definitely, they have to go to the workplace only.
Yeah.
You take the medical professionals, right? They obviously they have to go there. There is no other option left. Okay. So in such individuals, what I would advise is that definitely uh, they should have certain set of working hours for them as well. Okay, so they should have the clear set of working times, and also they should prioritize their self care as well. If they are able to prioritize their self care, and they are able to do some physical activities, breathing exercises every day regularly, so that it will make them more resilient, and also that will regulate their emotions as well.
Yeah.
Okay, so this is my take on that.
Okay. Coping strategies. Okay. Sir, I want to touch upon a very recent incident that I'm sure you are also aware of, about this, very young female employee from a multinational company.
Yes,
Yeah.
yes.
Who experienced work stress, and unfortunately, it led to her death. It is alleged that it's because of that, but what is your take as a psychiatrist on this? Is there, were there warning signs that was missed by both parties? Was there a way that her life could have been saved? What is your take on that entire situation?
Yes, definitely. Even I heard this news recently. It was going on in the news. So this female, very young female from EY, I guess, Ernst and Young. Yeah. So definitely there are certain warning signs we should definitely identify. So if an individual, whoever it may be, right? So if they are persistently undergoing some kind of stress, it could be because of the job expectations, high demands, or difficult boss, right? And heavy workloads. So these are all certain things. But when an individual feels that, right, it is taking a toll on my mental health, right? I am feeling too stressed out, okay, and I am feeling low, I am feeling detached from the the work related environments, I am not able to cope up with the things. Then definitely they should seek a help from mental health professional. Also, what I would advise them is that they should take frequent breaks in between, right? So in between the working hours as well, and also if they are working, for a month, if they are working at least 1 or 2 days, if they take break, and if they can hang around and have some relaxation for themselves, then that would balance their work and life as well. Yeah.
Yeah, yeah. Sir, I think one of the fear is that, especially with young professionals, they probably, this is their first job, they don't know how to say no, they don't know how to draw boundaries. So, what is your advice to people like that? Like, should that fear of job, losing their job, consume them? Or, like, how do you navigate such a situation? Because that is also an additional pressure, right? That fear of losing the job.
Yes, yes, definitely. So like I mentioned earlier, so there are individuals who joined recently, and all of a sudden once they exposed to certain environment, right? So they don't know how to cope up with certain situations, right? Then in that situations, what I would advise them is that they can seek help from their seniors, they can seek help from their colleagues, you know. So if they can seek help from colleagues or seniors or some mentors, or anyone who with where they feel that they will get help, if they
Hmm.
can seek, then that would definitely help them.
Okay. So asking for help is step number one, basically. Okay. Sir, also, in it's stress is very subjective. So what I define as stress would be very different from what you define as stress, or for other people. So what is something as a psychiatrist that if you see these warning signs, it is definitely stress. What are those warning signs?
Yes, definitely. When an individual undergoes a stress, right? So if it impacts their functionality, right, they're not able to function properly. That means they're not able to take care of themselves. No proper self care. Not able to function. Not able to socially interact with anyone, right? And socially withdrawn
Yeah.
among themselves, and also from the work related environments as well. Okay, and if this is happening repeatedly, and if they are also experiencing some kind of physical symptoms, like it could be restlessness, breathlessness,
Yeah.
some kind of anxiety or depressive symptoms, it could be low mood, right, not able to enjoy the things and which they were previously enjoying, right, and sleep disturbances, right? So these are all certain physical symptoms which we commonly encounter in the clients. Yeah.
Okay, okay. Sir, at what, like because you're meeting, these patients at a regular basis, at what stage do people come in? Like how many percent of people recognize the early symptoms versus, how many people come after it's been, a long time?
See, usually many of the individuals, almost if say for example 100 people are there, 100 individuals are there. So 100 individuals are experiencing stress, right?
Yeah.
About 70 to 80% of the individuals, they feel that it's okay, it will be manageable. Okay, so they feel so, but only what we see is only 20 to 30% seek help usually. That's what also the studies, some of the research studies which were conducted recently, that also shows that only about 30 to 40% seek help from the
Hmm.
mental health professional, or anyone else as well. Yeah. So we see very less turn around for seeking a help from the mental health professional particularly.
Okay. There are a lot of studies, obviously, that says the which explains the direct correlation between stress and physical, like how a mental health issue could affect physical, like it can lead to high blood pressure and insomnia, weakened immunity function, etc. So, can you explain some of the common physical symptoms that you experience while dealing with stress?
Yes, like I explained earlier. So, repeated stress. When an individual undergoes through repeated stress, what happens is that the fear center in our brain, amygdala, that it gets impact on the amygdala, which in turn leads to some kind of structural changes in the prefrontal cortex, right? So which is the location for the logical reasoning, logical thinking, problem solving, and decision making skills. Okay, so these will be greatly impacted. Apart from that, and repeated stress also leads to increase or rise in the stress hormones, which is
Hmm.
like cortisol, which has its impact on different systems of the body, like cardiovascular system, endocrine system, and digestive system as well. So people, we see they experience also high blood pressure, right? Some kind of chest discomfort,
Hmm.
and also breathlessness. Then um, Apart from that, digestive issues, they feel that uneasiness in the, some kind of discomfort, stomach upset. These kind of symptoms also we tend to see, and fatigue also, and body aches, headache. These kind of symptoms we usually encounter.
Okay, okay, understood. Sir, is so burnout is a word that is, it's like I don't want to say it's a buzzword, but it's, mostly everyone is using it now. Is burnout and work-related stress the same? What is your take on that? Like, what do you think about burnout?
Yes. So, see, work related stress or stress versus burnout, right? So, chronic kind of stress,
Hmm.
severest form of stress leads to the burnout, usually. Okay. So, it differs in the intensity and duration of the stress. So higher in intensity and the more prolonged duration is the burnout, and mildest form is the stress. Okay, so stress. If an individual is in stress, he will still be functional, right? But when an individual is burnout, then he would be emotionally detached. He feel unappreciated, feeling of ineffectiveness, right? So feeling of detachment,
Yeah.
these kind of things, individual of burnout experiences.
Hmm.
And usually when an individual is stressed out, he will be, hyperactive, he will be of high energy. But when
Hmm.
an individual is burnout, he feels, cynical, so detached, and so low that they won't be able to, take a step to do any work also.
Yeah. Sir, is it difficult to come out from that burnout stage? Like, I'm sure you meet patients who have reached that stage of burnout. So, is it difficult to get them back to, functioning normally?
See, there is nothing called difficult, but definitely if they can seek help, definitely they would come out of this burnout as well. Okay, so definitely if an individual, whoever is undergoing stress or burnout, then if they are able to prioritize their self care by doing some relaxation exercises, some practicing mindfulness, right, having a proper diet, regular exercises, then having a proper sleep, right? So if they are able to do this, and an individual, if he is in burnout, if they can seek mental health professional help as well, then definitely they would be able to come out of this. And there are also certain medications which also help them, come out of these things. And there are therapies as well, non-pharmacological therapies like CBT and all, that would also help them out.
Okay. So, at an individual level, what a person can do is they can, learn to, take time out for self care, focus on exercise, diet, and all of that, right? And reach out when they see early warning signs. Am I right?
Yes.
Okay. Okay.
Yeah.
So, one question I want to ask you is, so you yourself are in a very high pressure job situation, right? Doctors, I think, are one of the most overworked segments of our country. So, how do you deal with stress on a day to day basis, or what advice would you have for fellow medical practitioners?
Yes, definitely. See, whoever the individual, whatever the profession it is, uh, they have to prioritize their self care at
Same.
any point of time, right? Yeah. So prioritizing self care, right, and having a set of working hours, and they should also dedicate some time for their family as well, right? So if they are able to do these things, then definitely, they would deal in a very better way. And
Yeah.
also, what I see is, most of the individuals, even after working hours, okay, they plug with the office set of shift only, right?
Hmm.
Even they don't avoid checking the mails. They
Yeah.
keep concerned about what is going on in the office, or they are concerned about it. So definitely I would advise them to unplug themselves after the working hours, try to avoid checking any mails or any messages. And also they should not overcommit for doing the task as well. Okay, so they should have this time limit and limit set of working hours.
Hmm. Hmm. Okay.
Yes.
Sir, now I want to understand why some people are wired differently. So you see a lot of these CEOs of multi-billion-dollar companies, or even take for example our prime minister, who's been in the office since 2014, and he has a very calm composure. Like he obviously has so much responsibility. Even with CEOs, they have so much responsibility, but they're always calm. Like they're not jittery. They don't showcase any signs of stress. What is it that they are doing differently?
See, it's not that they're not undergoing stress. Definitely, they would also undergo stress, but it is not evident. If they are in front of the media and all, that is not that is not so evident. That
Hmm.
doesn't mean that they are not undergoing stress. Definitely, there would be stress for them as well.
Yeah.
Yeah, because of the because of the responsibilities they are having, right? So yeah.
Sir, but are people wired differently? Can some people handle more stress and others can handle very differently? Where does that fight or flight response come in? Like, is there a difference between people?
Yes, yes, definitely. See, what I would say is every individual's reactivity and response is different, right? The thing which is stressful for me may not be stressful for you, right? And which is stressful for you may not be stressful for me, right? So every individual's coping strategies, coping skills differ from person to person. It also depends on their development as well, their environment as well, their family environment as well, and their resilience and family history of any psychiatric illness. It depends on multiple factors.
Hmm. Sir, is there because you said resilience, is there any hack to build mental resilience?
Hack to build mental resilience. See, again, I would say the same thing, right? So if we are able to deal these things, whatever the stress we overcome in our everyday life, right? Whenever we come across some kind of stress, or say for example, if an individual is working in an office, and if his or her boss says something, rather than reacting immediately, they should take some time for themselves to analyze their thoughts, right? And if they can wait for some time, and if they respond to it, then that can definitely make them more resilient than
Yeah.
what they are. So
Okay.
each situation and circumstance differs.
Yeah.
Yes.
Sir, I'm sure you would have seen these videos on internet that is coming up of, especially I think this is very common in banking sector where, managers are screaming on Zoom calls or video calls because their team has not met targets, or, they themselves are under pressure, but there is that, it feels very toxic, and the internet is very quick to judge the manager. What is your take on that? Do you think he himself is under pressure, unable to cope, which is why he is transferring that stress to his team?
Yes, yes, definitely it could be, because if an organization is there, definitely the employer also feels stress, right? Because he also
Yeah,
has his own responsibilities, and employees also has their own responsibilities, right? So for certain individuals, or for any organization, okay. So what I would advise is that definitely they should have some kind of mental health resources, or the access to seek a help from mental health professional,
hmm.
or some kind of employee assistance programs,
Yeah,
okay, every monthly, or once in 2 to 3 months, then definitely that can help both the employer as well as the employees.
yeah, yeah. Um, so before I actually go and ask you to give advice to employees on this same line of thought, what is the advice you want to give to employers apart from having these monthly activities? Is there something they can do to, recognize warning signs in employees?
Yes, definitely. See, they. What advice I would give them is that they should have a assertiveness skills as well. Okay, so if the employer is having some kind of unrealistic expectations from the employee, so they should be able to communicate with the employer that this is my abilities and I may not do beyond that. Okay,
Hmm.
that is one. Secondly, communication is also important for the employee to communicate with the employer or the fellow colleagues as well. Thirdly, they should unplug themselves after the working hours. Okay, and they should set their time limit, and once they are out of the working hours, they should dedicate some time for their personal life as well, right? So if they are able to do this, then definitely it would help both the employee as well as the employer.
Okay. And okay, any programs specifically that you would like to mention to employers? Like, is there any program or any activities that they should incorporate in the company?
Yes, definitely. See, I have seen a lot of corporate institutes where they have these employee assistance programs.
Correct,
Okay,
you
by a
mentioned,
mental health professional or a psychologist as well, right? So if they are able to take these initiatives, right, mental health initiatives, then definitely that would, you know,
sir, what are some of the examples of mental health initiatives that they can take?
some of the examples like EAPs and also universal organizations as well, universal organization interventions as well, right?
Okay.
By having some wellness initiatives and
Hmm.
wellness mental health well-being as well, right? And some of the corporates, they also have the some playrooms or the relaxation areas for the employees as well. Okay, so if they are able to have such kind of environment at the you know so that would yeah, these kind of certain programs where they can incorporate.
Yeah, okay. Sir, one of the things that you mentioned is taking breaks, right? As one of the coping mechanisms. But people feel very guilty taking breaks or vacation time offs. What do you advise to people like that? Like, is it okay to be like not care and just take the vacation that is part of your employment?
Yes. So yeah, even I have seen many individuals. They feel guilty that after taking certain period of vacation, then after that they would be so much burdened about the work, right? So how I am able to cope up with such huge amount of work again? So they would have this, but definitely taking break would definitely give them that relaxation, and they should not think what is going on in the office or what is going to happen. It's okay when they move to the place, then definitely they should be able to cope up with the work or the amount of work they have. Yeah.
Hmm. Hmm. So, sir, would you say that drawing a healthy boundary at work is the first step that they should do? I think that is where it is, right? This,
Yes, yes, time management, and sharing responsibilities with the colleagues such
yeah.
that it reduces their workload as well, and peer support, right? Definitely, if you are going through some kind of stress, you ask your colleague or take help from your mentor that I'm going through such kind of thing, so that they will also guide you, they will also help you out, and yeah, these are certain things where they can follow.
Okay. Okay. Sir, I think we've got enough information. Is there any final, advice? I think you've already shared so many tips along the course of the webinar, but anything to conclude the webinar? Any advice you would like to leave the viewers with?
Yes, yes, yes. Emphasizing on the uh, prioritizing the mental health for this World Mental Health Day. The
Yeah.
theme is prioritizing mental health at the workplace. Emphasizing that, I urge every individual to take to take or seek help from a mental health professional if they are going through some kind of stress. Okay. And also they should also understand that not just the physical health but also mental health is also important, so
Yeah.
they should give equal importance to mental health as well. Yeah.
Yeah. Okay. Okay. That's. I think that's all. Thank you. Thank you, sir, for joining us today. It was a very insightful session, and I'm sure our audience will also enjoy it equally. And to the viewers watching, Dr. Aditya is available on Medicast for consultation. So if you have any questions regarding mental health, work specific or otherwise, he's available on Medicast. Please reach out to him through the app. Thank you so much.
Thank you.
Thank you.
Thank you. My pleasure.